The human respiratory system, an astonishing marvel of biological engineering, orchestrates the continuous exchange of life-giving oxygen for cellular waste, carbon dioxide. This seemingly effortless ballet, however, relies on the synchronized performance of a multitude of components, from the intricate branching of the bronchial tree to the delicate alveolar sacs where gas exchange truly occurs, all powered by the rhythmic contractions of the diaphragm and intercostal muscles. When any part of this complex machinery begins to falter, the body's delicate equilibrium is disrupted, leading to a cascade of observable changes. Imagine a highly efficient factory where a crucial conveyor belt starts to jam. The output diminishes, and eventually, the entire operation grinds to a halt. Similarly, lung failure isn't a sudden, isolated event. It's often a progressive decline, characterized by a series of escalating signals. One of the most insidious early warnings, often dismissed as mere fatigue or age-related slowing, is a persistent and unexplained shortness of breath, particularly during activities that previously caused no discomfort. This isn't the breathlessness that comes after a sprint, it's the insidious feeling of being unable to catch your breath while walking up a single flight of stairs, carrying groceries, or even just talking. The scientific explanation is straightforward. Compromised lung function means less oxygen is entering the bloodstream, and the body's compensatory mechanism is to increase respiratory rate and effort. Initially, this compensation might be sufficient for resting conditions, but any increase in metabolic demand, even minor exertion, exposes the underlying insufficiency. Think of it as your car's engine struggling to climb a hill. It tries harder, but it's not truly performing optimally. The key here is persistence and progression. A momentary gasp for air is one thing. A consistent, worsening struggle to breathe during routine activities is a red flag demanding attention. Another telltale sign, often misinterpreted as a common cold or allergies, is a persistent cough. But this isn't your typical occasional throat clearing. Lung failure-related coughs can be dry or productive, meaning they may or may not produce phlegm. The underlying cause varies. In some cases, it's the body's attempt to clear airways narrowed by inflammation or fluid accumulation. In others, particularly with conditions like pulmonary fibrosis, it's a dry, hacking cough caused by irritation and scarring of the lung tissue. The twist here is that the cough might worsen at night or when lying down, as gravity can shift fluids or secretions, further irritating the airways. It's a persistent, nagging presence, often resisting typical cough remedies. Pay close attention to its character and duration. A cough that lingers for weeks, especially if accompanied by other symptoms, is not something to shrug off. Consider the subtle, yet significant, changes in your everyday energy levels. Are you finding yourself unusually fatigued, even after a full night's sleep? Does the simplest task feel like an immense effort? This profound and unrelenting fatigue, often disproportionate to your activity, is a direct consequence of inadequate oxygen delivery to your body's cells and tissues. Oxygen is the fuel for every cellular process, from muscle contraction to brain function. When your lungs can't efficiently supply this vital element, your body enters a state of perpetual energy crisis. It's like trying to run a marathon on an empty tank. This fatigue isn't just about feeling tired, it's a deep, pervasive weariness that impacts every aspect of your life, often leading to reduced physical activity, social withdrawal, and even cognitive difficulties. It's a quiet alarm, often masked by the hustle and bustle of modern life, but its persistence is a critical clue. A more visually striking, and often alarming, sign is cyanosis, a bluish discoloration of the lips, fingertips, or nail beds. This occurs when there's an insufficient amount of oxygenated hemoglobin in the blood. Hemoglobin, the protein in red blood cells, is responsible for carrying oxygen. When oxygen levels are critically low, the blood appears darker, giving a bluish hue to tissues where blood vessels are close to the surface. This is a sign of severe hypoxemia or low blood oxygen and requires immediate medical attention. The twist here is that in individuals with darker skin tones, cyanosis might be less obvious on the lips or nail beds and might be more apparent in the mucous membranes of the mouth, tongue, or the whites of the eyes. This is a critical payoff for paying attention. Recognizing this sign can be the difference between life and death, signaling a profound respiratory crisis. Another compelling indicator, often overlooked until it becomes quite pronounced, is unexpected weight loss. Lung failure, especially in its more advanced stages, can lead to significant and unintentional weight loss. This is multifaceted. The increased effort of breathing burns more calories. Furthermore, chronic low oxygen levels can affect appetite and metabolism, leading to a catabolic state where the body breaks down its own tissues for energy. This isn't the result of a new diet or exercise regimen. It's a gradual, unexplained decline in body mass. It's a silent erosion, often signaling a deeper, systemic issue beyond just the lungs, as every organ system is ultimately reliant on adequate oxygen. Swelling in the ankles, feet, and legs, medically termed peripheral edema, can also be a surprising sign of advanced lung failure. This might seem counterintuitive, as swelling is often associated with heart or kidney issues. However, severe lung disease can lead to pulmonary hypertension, an increase in blood pressure in the arteries supplying the lungs. This increased pressure puts a strain on the right side of the heart, which is responsible for pumping blood to the lungs. Over time, the right ventricle can weaken and fail, leading to fluid retention in the lower extremities due to the backup of blood in the systemic circulation. It's a complex interplay of systems, where the struggling lungs ultimately burden the heart, demonstrating the interconnectedness of our bodily functions. The rhythm of your breath can also offer vital clues. Are you noticing a rapid, shallow breathing pattern, even at rest? This is known as tachypnea, and it's your body's desperate attempt to compensate for insufficient oxygen. By increasing the frequency of breaths, the body tries to maximize the limited amount of oxygen being exchanged. Conversely, some individuals might experience periods of slowed or irregular breathing, particularly during sleep, a phenomenon known as sleep apnea. While sleep apnea has various causes, in the context of lung failure, it can exacerbate existing oxygen deficiencies. The twist here is that family members or partners might be the first to notice these changes in breathing patterns, making their observations invaluable. Consider the subtle shift in your mental state. Are you experiencing increased confusion, disorientation, or difficulty concentrating? These cognitive changes, often attributed to aging or stress, can be a direct result of chronic hypoxemia affecting brain function. The brain is an incredibly oxygen-dependent organ, and even a slight, prolonged deprivation can impair its ability to function optimally. Decision-making might become difficult, memory might falter, and a general fogginess can descend. This is a particularly insidious sign because it can erode an individual's ability to recognize their own declining health, making it even more crucial for those around them to be vigilant. It's a payoff for being observant of seemingly minor behavioral changes. Finally, a less common but profoundly serious sign is hemoptysis, or coughing up blood. This is an immediate medical emergency. While the amount can vary from streaks of blood in phlegm to significant quantities, any instance of coughing up blood warrants immediate medical attention. It can indicate a variety of serious underlying conditions, including severe infections, pulmonary embolism, or even lung cancer, all of which can rapidly lead to acute lung failure. This is a dramatic and undeniable warning sign that demands urgent action. If you recognize any of these persistent or worsening signs in yourself or a loved one, do not hesitate to seek professional medical advice. Early diagnosis and intervention are paramount in managing lung conditions and improving outcomes. Your body often gives you warnings before a full-blown crisis, and understanding these signals empowers you to act. Remember, your breath is a gift, and recognizing its subtle whispers of distress is the first step towards preserving that invaluable gift. Don't just breathe. Understand the symphony of your lungs and the vital signs they continuously provide.